Well, good afternoon and welcome to today's webinar, which is heat stress prevention, keeping cool while these temperatures are rising. In case we haven't met, my name is Holly Foxworth and I'm a registered nurse. I'm also the Director of Marketing Communications here at Axiom, and we are so thrilled that you're joining us today. Obviously, as these temperatures are starting to rise across the country, we know that the risk also for some of those heat exposures also comes up. Somebody on our team actually was sharing with us some of the notes from some of the forecasts for this weekend, and it looked like Port Houston was they were in the triple digits. San Antonio, they're looking at 107, 108 this weekend. So definitely the heat has hit, and all we can say in Texas for those type of temperatures is bless your heart. But anyways, our goal today really is to help you understand what's happening inside the body whenever these heat exposures take place, how it is that you can recognize some of these signs of early danger, and then how it is that you can really take action. So you're also hopefully going to get to hear from Jim from Epicore. He had some technical difficulties getting on, but should be on shortly. And he's going to speak with you as well about some fantastic projects that they had with Chevron and how it was that they were able to eliminate their heat-related illnesses. So we have a fantastic panel of experts that are joining us today. We have, as usual, Dr. Scott Cherry. He's our Chief Medical Officer. He's going to be going through, walking through all the medical science behind the heat illness and some of those critical steps that you'll want to take. Also, we have James Ryan. He is the Chief Revenue Officer for Epicore Biosystems. He's going to talk to us about hydration variability and how it is like that wearable tech is really shaping the future of what we're seeing with heat prevention. And then we have Dara Wheeler, who is our Chief Marketing Officer, and she's going to highlight how early interventions, some of this nurse-guided care, all of the upstream really helps with the interventions and has a huge impact on what those outcomes can be for heat-related illness. So before we get started, there are several things on your screen that I want you to take a look at. Go ahead and mark your calendars right now. So we have a webinar that's going to be coming up this next month. It's going to be on June the 12th, 1 o'clock p.m. If you'll notice, there'll be a blue box that's there on the right upper hand side of your screen there with an RSVP button, and you can just press that button. That will immediately save your seat and it'll get you ready to join us for this next month. The topic is workplace suicide prevention, real stories and real solutions. And you guys are really in for a treat whenever you hear this one. We had a client, Arxis, that faced their own unthinkable tragedy whenever they lost one of their employees to suicide. So he's going to talk us through what that was like, how it is that you can recognize some of these silent struggles that are going on, what it is that you can do as an organization, and how it is that you can start to shift that culture there. So I've also asked Sarah Hathaway. She is our Director of Behavioral Health. And so I've asked her to join us well to go over some first aid measures that would be for mental health. So that would be including everything from, how it is that when you would approach someone, what it is that you would want to say, how it is that you would want to say it, etc. So definitely you'll want to check out that. It looks like that Debbie has sent us a button that said that it was linked to a past presentation. So Kane will take a look at that and make for sure that we get that updated before the end of the event that's here. One of the things I wanted to talk to you specifically about, though, is how it is that you can interact with us and how it is that you can win some of these great gifts that we like to send out after the event. So there is a Q&A box that's located right there at the bottom of your screen. And so that is how you can interact with us. So if you have a heat-related story, if you have a recommendation, if you have something that's happened to you, you have a question, anything you want to share there, that is the first place that I look whenever it comes to sending out gifts after these events. So definitely take a look there. Make sure you're familiar with where that is. And I will tell you also that we have a challenge for you in the very beginning. And so that challenge is going to be for you to tell us the weirdest or most creative thing that you have done or someone that you know has done to cool off on the job. So that's a quick peek. It's going to be at the beginning, so be thinking of what your answers may be, and you're welcome to even start sending those in now. But the one with the most creative definitely will take home a prize there. As always, the slide deck is available for you to download. It's there at the bottom of your screen there in the resource section. And so you're welcome to download any of the resources that are there. Not only do we have the deck for today, but we also have the full deck for Epicore that we're going to be talking about the wearable technology, along with some heat safety guides, some blogs. So really good resources that are there. And then my final announcement here is that it is time for ASSP Safety 25. That's going to be in Orlando, Florida this year. It's going to be July 22nd through the 24th, and we do have free expo passes. So if you would like a free expo pass, you are welcome to drop your name there at the bottom in the chat box, and we will make for sure that we get one of those passes to you. We love to see when we have clients that come and visit, even some that aren't clients that we've built such strong relationships with here in the webinars. They stop by the booth, and it's always a great time to be able to see and engage. The last thing I'll mention is that our very own Dr. Cherry has been hard at work working on a white paper that has to do with predictive safety. So it includes a risk calculator that you'll be able to put in all of your employee input there. And it's excellent. It's going to be great. So we should see that. You'll definitely see that coming your way within the next month. So with that being said, let's go ahead and meet our panel. Dr. Cherry, we're going to start with you first, and then we'll go to Dara, and hopefully Jim has been able to join us by this point. He says it isn't working. Let me work on that point. Let me work on that section while we're doing this, and I give introductions, and then we'll go from there. So Dr. Cherry, we'll start with you, and then we'll follow that with Dara.
All right, thank you, Holly, and good afternoon, everyone. My name is Scott Cherry. I'm Axiom's Chief Medical Officer. I'm board certified in preventive medicine, public health, and occupational environmental medicine. And I've been supporting industry, corporate, industrial, and military operations for the past 15 years, and it's a pleasure to be with you.
Thank you, Dr. Cherry. All right, and Dara.
Hey, everybody. I apologize for a little background noise. I am doing a really cool event up in Dallas and enjoying the heat up here. So enjoying practicing what I preach and trying to stay hydrated. My name is Dara Wheeler. I'm Axiom's Chief Marketing Officer, and I've been with Axiom for almost 19 years, bringing what we do to our clients and supporting them. And this topic is definitely one of our best that we work with our clients on, and how we can support reducing those heat-related illness and injuries in the workplace.
Awesome. Well, to give you an idea.
Holly, it looks like Jim is on the phone and might be able to introduce himself.
Oh, fantastic. Jason, can you show him?
He's on the phone.
Yeah, can you hear me?
Yeah,
yes, we can hear you, Jim.
Yeah, unfortunately, I wasn't getting audio from you guys, so I dialed into the phone number, which means you won't have video from me. But
that's okay. That's okay. We completely understand, and we appreciate your patience and glad that you thought ahead to do that. Would you like to give a quick introduction about yourself and Epicore, and then we'll jump into some of our content here?
Great. Yeah. So I'm Jim Ryan. I'm the CRO at Epicore Biosystems, and we're an industrial safety company that focuses entirely on heat illness and heat injuries. So I've been with the company about 2 years, and before that, I was with a variety of different digital health companies doing wearables and other online tools. But yeah, it's great to be here, and thank you for inviting me.
You're welcome. Well, thank you for joining us as well. We appreciate it. I'm going to have to pick your brain after this about that you have a history in wearables, because I think that's exactly where the future is headed here. So we are thrilled that you're joining us. To give you an idea of what we're going to be going through today, we're going to go through the hidden risk of heat stress. We're going to talk talk through proven prevention strategies. We'll get to personalized hydration insights, and then we're also going to talk about some of those real-time interventions that can make a difference. So do you guys remember that section whenever I was telling you about that? There'll be a question, a challenge question that comes up, and that we want you to give us your best answer. So some of the ones that we've heard in the past, we've heard everything from I stuck my hard hat in a freezer during lunch to I taped a frozen water bottle to the back of my neck with some duct tape. We had one, my favorite of all time was the hung out in the porta potty shade just for a break from the sun. So that was, I thought that was a genius idea as well. So it looks like that some of you guys are putting in some good ones here. Let's see, Sarah, you're saying when I lived in Washington State, we would make a point to go jump in the local lake and cool off before returning to work. My dad was a contractor, so we did a lot of manual labor. Good point, good point. All right, and then we have some others that are talking about going down the river. Let's see, we have another one, stuffing frozen bottles down their shirts. Oh, these are good. All right, Stephen has one, an Army story, and is saying while he was in training mission in the U.S. Army, that they were training in the desert in California, they started seeing signs of heat stress by day 2, and by day 3, the daytime temps soared between 115 and 120. Wow, that is significant. So he said that they had to ship home roughly 40 people due to those heat injuries. He said after that, the remaining soldiers dug deep into the foxhole and they got cool earth and shaded those holes with some poncho liners. He said it worked well. They had no more heat injuries at that point, but they still had an additional 28 days. Wow, that is significant in terms of number of people that you guys had to send home. We were going to continue to looking through some of these, and definitely, as I mentioned, we will keep you posted on who has the most creative and make for sure that you get a gift sent to you after this event. I'll be reaching out specifically. Dr. Sherry, I'm going to come to you first and just ask you if you kind of talk us through what's really kind of at stake whenever we talk about heat-related illness.
Sure. And before I go into that, your last slide was really humorous to me, or it's really amazing how when we do things that we think are helping can actually make us at more risk. So this middle one, taped a frozen bottle to the back of my neck. I'm actually even thinking even worse now with the duct tape. But, you know, obviously the blood flow to our brain can communicate our core body temperature. And so I've found studies that showed that if you know, a lot of us put cold towels on our neck. And so that can actually mislead our brain's thermoregulatory sensing ability to think we're cooler than we actually are. So, you know, it's probably a little bit more dangerous to do that, even though you might feel better. It's actually confusing your brain that you're cooler than you actually are. And so it's slowing down some of the adaptive things our body does physiologically to give off heat. So that just kind of wanted me to stick out. Sometimes we're hurting ourselves instead of helping ourselves, even though we feel better. So,
excellent points.
Yeah.
Really good points. Yeah. Well, talk to us about what's at stake then whenever we talk about heat-related illnesses and what is occurring with those.
Right. And so heat injuries is really a spectrum of kind of an inconvenience to life-threatening. And I think all of us have probably experienced some of these symptoms, and hopefully not a lot of us have experienced heat stroke. And so this spectrum includes mild heat cramps where our muscles start spasming after heavy exercise or even just heavy sweating, and it really throws off our electrolyte balances. And you know, now I think in the last 5 or so years, electrolyte solutions have become very common. You know, decades ago, maybe Gatorade was out, but that's about it. But, you know, our electrolytes are very crucial in regulating how we actually control our muscles voluntarily and involuntarily with like our heart and things like that. So, you know, we can easily get you know, heat cramps can actually be disabling where you can't even really move and need emergency room treatment for such severe cramping. So you should take even cramps seriously. I think probably the most common thing out there is heat exhaustion, where our body, we just feel fatigued, we feel off. We may even have symptoms of feeling sick to where we almost feel like we have a cold. We have cold and clammy, feel like we're vomiting. Maybe we're confusing this with some kind of infectious disease or things like that. And then really how you differentiate kind of this spectrum of, a medical urgency to a medical emergency is your mental status. So how well is the person thinking? So once someone's cognition is changed, that's classically defined as heat stroke, and really that's a medical emergency. And so the body temperature is very, very high, over 103 degrees. They've probably stopped sweating. They're red, dry, a very thready pulse. So their blood volume is greatly reduced. So their heart is beating very quickly to try to keep up the pressure from a decreased blood volume. And again, this is a medical emergency because not only are we having symptoms in the body, but also in the mind. So just many things can be happening, organ failure at the brain, but also all of the other critical, you see kidney damage because the kidney actually needs to be well perfused all the time. And so this can be very subtle though. So I remember when I saw a case of heat stroke a couple decades ago now, it really sneaks up on you. So I remember talking to someone who, you do the classic, person, place, and year, so to speak. And so I asked the person, what is their name? And they said Wallet. And so that was very, and so I said, where are you? And he said, Rebecca. And so, this can be very subtle, but then, because he was walking, he obviously was very tired, but once someone has, they're not making sense, you need to really call 911 and engage emergency services that way. And so I'll leave it at that, Holly. Yeah.
Yeah, definitely. There was a question that you guys are sending in some great ones. I'm loving all the pickle juice. I'm loving all the things that you're sending in here.
Yeah.
But there was a really good question that had came in that I was going to ask you real quick, Dr. Cherry, from Nicholas, and was saying that he had seen some ice vests being used, and he was asking, does that have the similar issue for tricking the brain, and what major controls would they need for the rest shade water there?
What was the first part of that, Holly? I missed it.
He was asking about an ice vest, and so he was saying that he's seen ice vests being used before, and he was asking if that would have that same effect on the brain that you were talking about whenever we were talking about the duct tape and
the way I think of it is the ice vest has more utility, so it's not necessarily causing an unintended consequence of fooling the brain that we're actually cooler than we are, because we have more surface area. So you actually are cooling the body down, whereas a lot of people put, ice right on the neck and just keep it there. So it's cooling kind of the blood flow, but not enough surface area of the body, so to speak.
To make a difference. Okay. Thank you for answering that. We appreciate it. Well, let's talk about the bigger picture then, and the impact that heat illness is having. Because it seems like that we've been deceived a bit.
Mm-hmm. And heat stress is, I was a military physician earlier in my career, and that was absolutely a huge focus in military medicine. Even before I was a doctor, I was a medic as well. And that was something even at the kind of company level that the medics were always focused on, or even just non-medical leadership. And so this is really something that is a kind of pervasive exposure and risk to really everyone that's doing, physical work. This first part here actually hit me despite my kind of in-depth knowledge of heat stress, that there's 40 times more heat deaths than reported by OSHA. And, what this is getting at is, there's so many other types of diagnoses that will then be loosely tied to heat stress. So like heart attack, stroke, even diabetic kind of exacerbations, things like that. And so it may not be the primary driver, but this is an absolute great statistic that shows that, obviously OSHA recordables or an OSHA reportable for a death is very significant, but there's a huge magnitude of heat stress that's causing deaths that's not reported to OSHA. And regardless, it's not actually on our awareness, right? It's some of these things isn't necessarily about informing OSHA, right? It's about protecting the workforce and preventing these types of catastrophic incidents. And so obviously from just other metrics, it's very, very costly. If we have to send someone to the emergency room, it's going to be very, very expensive because they're going to have symptoms that are very broad and concerning for kind of a heart attack or stroke. And so they are going to be getting, tests that are going to be very costly, especially in the emergency room setting. And so something that I think is super interesting to me is you can weigh yourself kind of at the beginning of shift and then at the end of the shift, or even every day. And if you notice you're losing weight and you're not really losing, your waist isn't getting thinner, you're probably losing water weight, which, if you're just trying to look better in a suit or something, that's fine. But if you're really worried about heat stress, I actually track that for myself when I cycle in the summer times. But here, we're showing a 2% fluid loss can lead to cognitive impairment. And it also leads to significant physical impairment. So say you have a certain amount of strength, dexterity, fine motor control, you're going to now be at much higher risk for all of the other classic injuries that aren't necessarily classically associated with heat stress. And I think when Dara and I were working on this earlier in the year, it was very surprising to me that, obviously there's a kind of a dose response curve with, as temperature rises, you have higher risk of heat injuries, but every other classic work-related injury goes up as well. Slips, trips, and falls, motor vehicle incidents, material handling. And it's a mix of that cognitive and physical capability decline because our mind and body we're not 100%. And so, these injuries are occurring on the margins when we become very fatigued, physically and mentally. And so a good rule of thumb here would be a 1% temperature rise equals a 1% injury increase. And so that's dramatic. And then the last thing I'm going to say is, depending on the type of PPE that your employees are wearing, if they're wearing a lot of the fire retardant type materials or other materials that are impermanent to breathing well, the functional temperature can be 10 degrees higher on average than what kind of is on the thermometer, or more accurately on a wet bulb globe temperature reading. So just keep all those in mind.
Absolutely. Dr. Sherry, there were some really good questions that have came in while you've been talking about this. Megan was asking about that specific stat about the 1% temperature rise equals the 1% increase in the injury rate, and was asking, do you know if there's a particular temperature that starts to apply?
Yes, I think significantly it's probably around 90 degrees gives kind of this 1 degree to 1% temperature rise is a 1% injury increase, but it actually will kind of become a little bit more exponential versus 1-to-1 at over 100, 110 degrees. And another thing I would just say is it also depends relatively, right? If it's, we're here in Texas, and what's interesting is we kind of have seasons here. So it actually does cool off in the winter. So I would say even if we're well below 90 degrees, but say it's 75 or 80 degrees out, but we're coming out of a 40, 45, something significantly colder, then our bodies haven't acclimated to that temperature increase. So it's very relative to where you're coming from too. So I would just kind of be aware of that. It's rate of change, and absolute temperature change from recent, what's kind of been, the previous temperature out,
I was just going to mention a couple of things that kind of led Scott and me to investigate this a little bit more in depth, and that was that we were seeing increases in injury rates beyond heat-related illness when it was getting warmer. And so it kind of led us to start questioning some assumptions around what is causing some of these injuries outside of heat-related diagnoses. And so that's part of what prompted some of these conversations. And Holly, Scott, and I are collaborating on a white paper and a risk profile. So that'll be coming out soon. So make sure you're following for that, because it will start helping you predict some of those risks associated with these heat increases. So please be ready for that when it comes out soon.
For sure. And there's been a lot of questions that you guys are submitting about what do I do about, where do I put the rags, and, should it be cold, should it be ice, et cetera. We're going to get into that very shortly. So I did definitely see your questions that are here, but I did see one that I thought was really relevant. And I was going to ask you, Dr. Cherry, if you wanted to weigh in here. They were asking that can heat exhaustion come on quickly for folks that are in and out multiple times from an AC cooled building to high temps? So you're going from an AC building where it's nice and cool, and then you're going outside, so you're going back and forth constantly. Could you speak to that and the risk that's associated there?
And maybe I'll start off with kind of a big picture of heat stress can be cumulative and not just acute. And what I mean by acute is within a day. So sometimes we'll see people report heat or manifest heat injuries on the coolest day of the week, but the rest of the week was much, much hotter. And so our bodies actually kind of fatigue, our physiology fatigues in the sense of being able to cope with that heat stress. And so sometimes people may manifest some symptoms and they're actually thinking, oh, maybe I had food poisoning and that's why I feel weak and nauseous. On the cooler day, say it's a Friday and it's been hot all week, but Friday it's a cooler day, and so it's cumulative. So yes, absolutely. If someone is kind of hopping between the office and field work, even though they're cooling off at times, they're still it's kind of an insult to their resilience of kind of coping to heat stress. So. You want to be very mindful of that. So obviously there are ways to kind of adjust that we'll talk about later on, but you want to be mindful if someone's cooled off, but then goes back to kind of their previous work and is deteriorating again, that is a red flag,
Absolutely. Okay, thank you for that. Dara, I'm going to come to you next and ask you if you would talk to us about the classic story that we've shared before, but it just so perfectly explains why the importance of early intervention is.
Absolutely. And I know a lot of you have been putting some great questions in there. We'll get to that. I'll try to get through this pretty quickly so we can get through to some of the questions. We had a client that gave us this case study actually because it was the same client, the same job type on the same day. And they had one employee go to the emergency room and one employee that called us. The employee that went to the emergency room did not call us. And this was early in the relationship with the client, and they hadn't fully rolled it out and educated their employees on the importance of getting nurse intervention quickly in a scenario like this. And a lot of you have asked questions like, what should we have on hand? What are the interventions that are appropriate for heat illness or heat symptoms? And what's really critical is that I think some of you have even pointed out, it is so dependent on somebody's individual physiology, their even things like their mental health, their physical health, what they've done the prior days. Like Scott said, it can be a cumulative response. And so with this scenario, we had two drivers. One ended up in the emergency room. And like Scott said, when you end up in the emergency room with symptoms like this, you end up with a lot of treatment and a lot of cost to have the same situation and diagnosis as the second driver. So it was a very expensive emergency room visit. They did IV fluids. It was a OSHA reportable because of some of the interventions that were completed. And the second driver, they called us and we started assessing with the nurse team and based on the employee's underlying medical history. And we got that employee interventions that were appropriate for the employee and the illness that they were feeling. The employee stayed on the job. It ended at first aid, and it was a very comparatively inexpensive experience compared to an emergency room visit with tons of intervention. So we like to use this as an example that how important early reporting is in heat-related illness. The earlier we get involved, the earlier we can start those measures and make sure that employee is taken care of, and we don't end up with something with an employee in the emergency room unnecessarily. So we like using this as a great example.
100%. It so accurately, explains and gives you a visualization of, what the different outcomes there are of one being treated, with conservative measures versus having to be in the ER. So thank you for sharing that. We are going to go ahead. Yeah.
If I could just add, I think this case study, I think having the medical framing of each kind of provider is really what drives the huge difference. So when you go to the emergency room, an ER doctor, their job is to determine if you're dying or not. So they're ruling out, as soon as you walk through the door, they're there to rule out, is this something that is life-threatening or not? Whereas kind of the work we do at Axiom, we are screening for obviously life-threatening conditions, but it's through the frame of, is this something that we can treat at first aid? And is it amenable to first aid? Or, especially with heat stress, there's a lot of gray area. But again, if you go to the ER and you do have kind of chest pains, lightheadedness, dizziness, like you are going to qualify for a full kind of cardiovascular workup very quickly within, there's not a lot there because again, the ER is the final place where people are going for potentially emergency, assessment, right? And so emergency room physicians cannot miss a life-threatening condition. So again, getting treated earlier is much better than being treated later. And, the time I've been with Axiom for the past 8 years, we talk about the golden hour and how important it is. And I think we lose how important it really is because I think with heat stress, if someone is starting to have early symptoms, they're so much more amenable to first aid measures before they become highly symptomatic. And so that's what really drives the two disparate outcomes for really the same level of injury, of heat injury here. So I just wanted to kind of hammer that home that when you go to the ER, it is going there to, there's nothing more severe than going to an ER for medical treatment, which if needed, that's obviously the right place. But if you go there with a more minor condition, you may receive a lot of medical evaluation.
Absolutely. I think that particular guy, they did a cardiac and a neuro workup on him, if I'm not mistaken. Yeah. So he was there quite some time. Well, Jim, we're going to come to you next. And I was going to ask you if you could speak to us about why some of the personalized hydration really matters there.
Yeah, absolutely. So, we've discovered in our work with the Gatorade Sports Science Institute, and you can see that in some of the papers we've published in peer-reviewed journals with the researchers there, as well as with some researchers at Northwestern. There's a huge variation in both sweat loss and sodium electrolyte loss among individuals. And that variation is independent of things like ambient temperature, the level of physical exertion. So you could have, and you can see here in this slide, people working side by side in the same location, under the same heat index, doing the same work. And they could have up to 22x different sweat rates. That obviously is the most extreme that we've recorded. In real life work sites, our devices collect this data every 20 seconds and we aggregate it. We typically see about a 10x difference. in sweat rate among the highest sweaters compared to the lowest sweaters. And similarly with sodium, we can see, in our research, we've experienced up to 15x. In the field, we tend to see, 5 to 10x.
Wow. So I think what I'm hearing you say then is hydration is not kind of a one size fits all type of scenario then. So it varies, it ranges then basically, it could be on a variety of factors then that could impact what it is that your personal needs are.
Yeah, that's exactly right. And you can see on the right-hand side, there are certain things that you might have some kind of insight into and certain other things that you just have no way of knowing. And so without, for example, acclimatization, I mean, we all know that, if workers are rotating onto a site from somewhere else where it was much cooler, and this is their first week, first 2-3 weeks working in hot conditions, that's when the risk is quite elevated. But there's other things that you just won't know. And, like you don't know how hydrated they were when they started their work. You don't know their fitness level, what they eat and drink. There's genetic factors that you'll never know. And so the key is to find to actually measure everybody's sweat loss individually. And that's what we developed, a product that does that.
Wow. Talk to us about why the timing matters then whenever you're looking at preventing an accident from taking place.
Yeah, well, as Dr. Cherry mentioned earlier, we think when we think about heat injuries, we tend to think more of the acute types of injuries that, send people to the hospital or even worse, up to and including heat stroke. But the real, I think in terms of the volume of first, human suffering as well as productivity losses and, injuries happens much earlier in that process. So as we've seen, dehydration fairly quickly leads to fatigue. We've all experienced it. Reduced productivity, reduced muscle strength, and then cognitive impairment, headaches, cramping. And these things can cause other types of injuries. So, you could momentarily become dizzy from dehydration and fall off of a ladder. You could, crash a vehicle. You could crush a limb. You could spill something that causes you injury. So all of these things, while they're rarely recorded as heat injuries, often, that dehydration, the physical and cognitive effects of dehydration are factors in that. And so it's important to intervene much earlier before people get to that point. And, when we first decided that we would tackle this problem, we had a partner in Chevron who came to us about 4 years ago, and they had seen all the work that we were doing in sports and fitness with Gatorade, and they said, hey, we got athletes out there on oil rigs, they're working just as hard as an NFL lineman. Can we protect them? And, the combination of the individual variability and the importance of intervening early led us to develop a product that measures sweat loss directly. So rather than waiting until body temperature and heart rate are elevated, skin temperature is elevated, which is, at that point, you're really in serious trouble and you need to take somebody out of the field, or they might already need to go to an ER. We're measuring sweat loss, and so we can tell every individual worker, hey, you've already lost a liter of water today, and the device vibrates, and they know, hey, I got to replenish that water that I lost, and it keeps them from getting further down that chain.
Wow. Well, that was going to be my next question was, whenever I heard about this, it was basically, how does this even work? I was trying to visualize, talk us through, kind of the placement and how the system all works together.
Yeah. So our technology came out of the Northwestern University Sweat Lab, not officially called the Sweat Lab, but it's a lab run by Professor John Rogers, and he and the team there really have been working with sweat for decades. And we developed a device that you stick on your arm. You can see here in the picture. And as you sweat, the sweat actually physically flows through the device. And so we can measure your sweat rate, and we can tell you exactly how much sweat you've lost. So, you can see that on the app. It'll tell you in ounces or milliliters, since you turned the device on and stuck it on your arm, how much sweat have you lost? Now, obviously, workers carrying phones around is not very practical, so we built in haptic alarms. So the device itself vibrates when you lose 500 milliliters of water. We train when people first start using the devices, hey, here's what a vibration feels like. We simulate it for them. They said, when you feel that, it's time to have a bottle of water. So we kept it super simple. They don't have to have a phone with them. And if you follow that advice, and we find that most workers do over time realize that following that advice makes them just feel a lot better. You never get into that danger zone. And if they don't follow the advice and they don't rehydrate, once they go on to lose 2% of their body weight in fluid, which is we discussed earlier, that kind of danger zone of cognitive impairment, the device will vibrate harder and won't stop until you acknowledge it. And so that's when you know, all right, I ignored the other alarms. If I ignore this one, I'm in big trouble.
Yeah. Wow. So talk to us then about the success that you guys had with Chevron. You had talked about that they came to you and you guys put this project together. So what type of issues were they having with heat, and then what type of results were you seeing afterwards?
Yeah, so that's a great question. We already had the technology working in the lab, and then Chevron said, but will it work in our environments, which are really, really tough. So offshore, in the basins, at drill sites, pipelines, confined space work. And so, we spent over 2 years just testing the device with Chevron and making improvements in all of those types of environments. So, they told us it has to be intrinsically safe, so we did that. They told us they don't want to have to recharge it, so we went with a long life sealed battery that we'll replace once a year. They said a lot of our sites have no internet, and so make sure that it can work without internet. And we did it. We put onboard memory, and it can store its data and transmit when it comes into internet range. SOC 2 Type 2 was an absolute requirement for data security, and we had to test it up to really, really hot environments. So you can see all of that reflected here.
Wow. We have some comments that have already came in. Sarah was already talking about that she has a lot of people in the oil field industry that she definitely wanted to share that information with. So I'm sure that just to reiterate, there is information about Epicore that's listed at the bottom there in the resource section. There's the full guide that's there. There's their full deck, and it also has the contact information on how you can reach them. And I'm sure that they can speak to you about price and things as well. Brian, you had asked about that. Well, thank you for that. That is fantastic. And so just to reiterate one more time, Jim, before we go back from that, so they went to 0 heat-related injuries. That's correct?
Yeah, so we put the device, this is at one specific site in San Joaquin Valley, Southern California. We rolled out the devices to everyone who was at risk, and they went to 0 SIPs for the first time in 4 years that year. This was last summer.
Wow, that is fantastic. It seems like that is where we're headed. So I know I geek out and I get excited about it. I'm sure the rest of everybody else on the team does as well. So that's fantastic. Jim, again, I appreciate you sharing that with us. And looks like that we have some additional questions we may get to right after we finish, if that's okay with you.
Absolutely.
All right. Dr. Sherry, talk to us then about the fundamentals, about how it is that we can prevent this. I'd also like for you to mention some of the OSHA updates. That's been a hot topic lately as well.
Certainly, and I really, what you presented, Jim, really seems very compelling. And then just the data that you presented about the variability between individuals it actually gets lost on me, I have to admit. And I see this even in my personal life, cycling, where there's always a few of us that just tend to get cramps or get heat exhausted sooner than others. And, so you can do as many preventive things as possible, but you have to recognize and be self-aware, and then also take care of those that you work with as well. So, I think awareness is maybe one of the biggest prevention things to be aware of, because we're all different, or we may have just different resilient factors. Or one of the things too we haven't mentioned yet is just your medications and medical conditions can dramatically increase your risk. And it can be something as simple as like a Benadryl or an antihistamine, which dramatically kind of blunts your body's ability to respond to heat stress with, vasodilation, dilating your blood vessels and things like that. But I think really the things that you have to do is hydration. And so, I think what we just heard about is having kind of this objective awareness. But you can have kind of just administrative controls in the sense that you need to drink every 15 minutes, every 30 minutes, every hour, something like that. And it really needs to be scheduled and regular. It should not be optional or passive based on each individual's kind of personality or insight into this. It really needs to be, regular and scheduled. And then cooling stations or just breaks and shaded, ventilated areas are huge. And those should also be, scheduled and part of kind of a regular framework. One thing that I've kind of learned about is obviously, we want our employees and our companies to be productive. And so there's this kind of focus on output. But if we actually can include some behavioral performance metrics with health and safety, that could be kind of a game changer in the sense of making behavioral changes. So, obviously work output is critical, but also just measuring like, are you taking your breaks, your hydration, things like that can be kind of a nice way to ensure that that you have a system addressing heat stress, and then, shift adjustments, especially like today in Texas, it's unusually warm for we're just getting out of spring into summer. And so I think this is a high risk time where, none of us are acclimated to kind of this high humidity and things like that. So, you need to have adjustments, whether it's the shift or the season. And then, so acclimatization. So new workers are especially at risk for injury for all reasons, let alone heat stress. But if, say you've come back from vacation, you actually need to kind of get acclimated to the work environment. And so, having some kind of policy that slowly graduates, exposure over, at least a week or two would be the best. And then clothing, right? Like, so obviously PPE is critical, but if you can have a focus on also, is this creating additional heat risk load to the person is absolutely, critical. And I think really leadership or management training to where they can be kind of that secondary layer of being able to spot symptoms early and know when to escalate. And then we did talk a little bit about just kind of a look out for your buddy at work as well. And so, I'll leave it there.
Yeah. So I was going to ask you if you would talk about some of the OSHA things. It's like we've seen such a shift since we had a change in leadership. So we thought we were going to have a heat safety standard, and then we weren't going to have a heat safety standard. And now it seems like that the topic has come up again. So I was going to ask you if you could give us just a quick, brief overview. So that everybody can know where we stand.
Yeah, as a resident, I'll admit, like I kind of got a little pessimistic that maybe OSHA would not make any new rulings. And so there was a silica standard update a couple years ago, and And just this year now, OSHA is re-looking to have their hearings on a heat stress prevention standard. And so I think now there's virtual meetings going to be set up, I think, for June. The Federal Register's commentary period for industry, I think, has already concluded this year. But this is, again, on OSHA's radar. And it does make sense because, as I talked about this earlier, this has been going on throughout my whole career of maybe even 30 years now, if you include my time as a military medic. And so this is a persistent challenge for, everyone, employers, employees, regulatory bodies. So, I think having a system in place, which, looking at some of the technology, I think that will give us potentially more insight and more tools, right? I'm a big fan of kind of the Hawthorne effect where, whatever is measured is improved, right? Like that's why you have a speedometer in your car. It gives you a sense of, am I going too fast or too slow? So being able to have objective data to see if you're, dehydrating faster than the others, right? So if you just have administrative controls, you really need to be aware of that individual variability. Someone probably is going to fall on those outliers. Like someone can go many hours without a hydration or cooling station break, but there's going to be others that are falling in the kind of the average, profile. But you may have folks that are kind of, losing more electrolytes sooner and more water sooner, so they need help quicker.
Absolutely. Dare, talk to us about building a safety system, and then I want to get to a few of the questions that we had. There was a lot of them, and one specifically was asking about the electrolytes, levels of electrolytes.
Yeah, absolutely. So, I think it's no surprise that systems are the best way to handle some of these issues. And so making sure we've defined processes and have training available for how to handle these various scenarios. The best plans fall short if nobody knows what's happening. And so making sure everybody is aware of the process and what the steps should be within that process is really important. Upstream visibility or upstream intervention is really important. And I think between the Epicore system and what Axiom preaches, we definitely believe very strongly in early intervention and making sure that the earlier we intervene in these scenarios, the better. The wearable data, making sure that you are tracking the variability between people's own physiology and systems, and making sure that we're treating everybody individually, I think is really important. Thinking about this beyond what we're talking about with OSHA from a compliance standpoint, it is really critical to think about how we help employees come home every day healthy and safe. The early intervention piece and immediate intervention, I think we've seen a few questions in the chat, and I know that Jim can address some of these individually about data and getting employee adoption to wear something like an Epicore system in terms of how you think about data. That's where this beautiful relationship between health and safety and what Axiom does comes into play, because if you think about it, when you think about systems and intervention, if somebody is dealing with something or struggling within a scenario, that's where this nurse relationship and this trust in a medical provider really comes into play. And so when you think about having that layer between the company and the individual within this workflow, having a team that is a very trusted medical team to be that intervening point to make sure the employee gets taken care of and gets their medical history heard in addition to these wearable data points, I think is critical. So
Absolutely.
thank you all for some of those points and questions. And I'll stop talking so we can actually answer a few others.
Hey, I was going to tell you guys too that I'm hearing from production behind stage here that the link is fixed. So if you want it to go to the upper right-hand side for the suicide webinar that we were talking about previously, that link should be restored. So you should be good to go there. The first one I was going to come to you, Dr. Sherry, and then Jim, I'm going to come to you next. Ken was asking, is there a level that can be considered too high of a daily dose of electrolytes?
Yes, so I think that's a great question. So I would say the safest approach is to use kind of commercially available electrolyte solutions. Even if you're using a powder, follow the directions about how many scoops per so much water. There's always been this thing about just taking salt tablets. You can kind of overdo it, perhaps if you're not familiar with guidelines, and it really matters. So, one interesting thing is to actually weigh yourself maybe at the end of the shift, or if there's a way to do it, periodically throughout the shift, but you want to drink almost as much water as you're losing weight-wise, maybe even, another 50% more than what you're losing. But you can kind of overdo it with just salt tabs if you're not really familiar with what to do. So use commercially available products that, either are already pre-mixed or give you guidelines on how to mix it.
Thank you for that. Jim, I was going to ask you, there's been multiple questions here about that were asking specifically about the Epicore product, but some of them that we are seeing here is are you guys seeing any resistance to from employees that have been asked to wear them? How do you protect that data? Have you run into any issues, things of that sort?
Yeah, that's an excellent question. And, that was a big concern of Chevron as well. Chevron has a lot of sites where, there's the workforce belongs to unions, but even at sites where that's not the case, everybody in the back of their mind thinks, well, they're putting this device on me, are they tracking me? And the quick answer is that we don't give the employer any information that is linked to an individual identity. And so Chevron asked us, for the data that goes to the cloud, they just want to see the data in an anonymous way. And so we designed the system so that the data that's collected in the cloud and the data that Chevron or any other employer using our devices, the data they can see is not tied to individual identities. And so, when we explain that to the workers, they generally feel a lot better about it. And also, they understand, and we explain this as well. The only data that we're collecting is sweat rate, sodium concentration, skin temperature. We don't collect things like their location. We're not tracking people. So, we explain it as it's not a tracking or monitoring device. It's a safety device. It's like a gas monitor. When you are in an unsafe situation, it gives you, the worker, a warning, but it's not tracking or monitoring you.
Gotcha. So that data then stays secure and it doesn't necessarily go back to the employer is what I'm understanding you say, correct?
Yeah, it's anonymized so the employer can see in the cloud, statistical data about how the workers are doing on sites, how particular groups of workers are doing, but they don't see, the names of any employees, unless they've gotten that permission and shown us that. So the exceptions would be things like public safety. So, if you have police or fire, they really need to know who's wearing what device and who's in trouble in terms of their hydration in real time. But if you don't have a need to know that, there's the system by default doesn't give you any identified information.
Excellent information. Well, guys, we are actually 1 minute past because we're 1 minute and getting late starting. So but we appreciate you joining us today. Again, as I mentioned before, you may have to refresh your screen, but that information is up there located for the next webinar. We appreciate all of your questions. It looks like I have lots of gifts that I need to be sending out after this event. So I will get my thank you notes ready and I'll be in touch with many of you, but great input. We appreciate all of your comments and your questions, and we look forward to seeing you then June 12th at 1:00 p.m. Have a great day.